Patient complaints, it is unfortunate that you call it complaints, but it's an acceptable position where a person or a patient, if they are not happy about the care that they got, they're allowed that they come and make us aware, because we are aiming at providing quality care. Therefore, if a patient perceives the care that she got or he got as not being the quality that we've promised, we therefore are opening our doors to say, please come in and lodge your complaint with us. There are several ways that complaints could be lodged. The first one, which is most important, is that at the present moment when the incident happens, you report within that stipulated time, especially when you are there, because it's easily resolved. You are allowed to request the CEO if it's the hospital. You are allowed to request the facility manager if it's the clinic. Whilst if it's in the ward, you are allowed to ask for the sister in charge of the ward. Then you explain to them. And I need to explain that even at the pharmacy, at the time when it happens, you are allowed to ask for a pharmacy manager or a supervisor. At the x-rays, you could also do that as well. So in all areas where the incident happens, it becomes very crucial that it gets addressed on the spot. The second one would be if it means that you left or the patient left without having lodged their complaint. Therefore, the patient is allowed to phone through and lodge their complaint using the telephone lines. Thirdly, the patient is also allowed to use the email addresses that we provide for the patients. Fourthly, the patient could also use, we've got an ideal hospital app that the patient can use to lodge the complaint using the app. And all those, as we receive them, they go to the quality managers of the hospital or of the clinic, and then they get captured there as the patient's complaint, so that we start the process of addressing the complaint. We've got stipulated guidelines that addresses the time that it should take, but it must be understood that it really doesn't have to go like that. If it has got to be addressed on the spot, it can take a minute or so, depending if it's a complaint or a consent, that an operations manager could just resolve it on the spot. But in terms of the stipulated time frames that are legislated, we need 5 days that we use to acknowledge that we have received your complaint. It's either we phone you back or we write back with your email. Then after that, we've got 10 to 15 days where we look into the complaint itself and start looking at how do we classify this complaint. If it's not a complicated complaint, it must be resolved between these 10 to 15 days, but it must not exceed a period of 25 days. Legislatively, it should be 25 days, but for us in Gauteng, we're looking at 10 to 15 days if it's not a complicated complaint. But if there is a way of saying the complaint is a bit complicated, meaning that it has got to be escalated and reported somewhere differently, we then allow a period of 25 working days. We want to encourage people out there that complaints, we're not taking complaints as if people talk too much or they see it fashionably. We're taking those complaints seriously, because the aim of a person complaining is taken because we think that a person is complaining because they want the problem to be solved. And on our side, we must solve the problem and encourage staff so that we do not have the same complaint happening. It becomes a learning curve. We need to learn from the complaints.